Network.
Hey there, pharmacy community. This is Todd Uri, founder of the Pharmacy Podcast Network, and I'm excited to bring the pharmacy industry. Pharmacy community. I'm excited today. We get an opportunity to dive into live internet radio, and what that means to the pharmacy community is really more information and more interaction. We've always wanted to do more interaction with our listeners. So if you're listening right now and you want to participate, you can always sign up at RxFusion.live and we'll let you into the conversation. We're also going to have on Twitter a following for every one of our sessions, every one of the interviews that we're doing, hashtag RxFusion, so that you can be part of the conversation. Send us a question as we are speaking with guests. And of course, my trusted friend and Pharmacy Podcast Network host, and one of the most influential pharmacists, in my opinion, for the movement of where the community pharmacist is going, Mr. Ken Sternfeld, pharmacist and scholar.
Wow. I'll tell you, you got to talk to my wife, Todd, because influencer and all the funny words you said, I don't know, after 40 some odd years, I'm not feeling that, from my bride of 44 years. So help us.
The wife factor always comes in, doesn't it?
Thankfully it does. 42 years, and I wouldn't be anything where I would without the woman of my life, Ronnie. So I'll call out to Ronnie. It was her birthday a few weeks ago, and always love to celebrate happy times with family and friends.
Happy birthday, Ronnie. I've heard a lot about your wife, and I've seen her you've even shown me on her on previous video chats that we've done. So family is the most important thing. So I'm glad that you brought that up.
Thank you. It's my pleasure. And you actually are part of our family, because sitting here looking at my pharmacy podcast coffee cup that you sent me, I guess about 4 years ago, and I still use it. Right now, it's a cold drink today, not coffee in the morning. It's a little call out for Polar Seltzer, the cranberry lime flavor. I don't know, maybe we can get them as a sponsor, but really, really refreshing. And I drink it out of my pharmacy podcast mug, and it reminds me how fortunate I was that you and I kind of bumped into each other and have been doing some cool things for a couple of years, and we haven't even started to get to the nitty gritty of how we can advance our career together.
I agree. I do feel like I'm just starting. October 19th, 2019 was my first day of full-time Pharmacy Podcast Network, and the work of the publication and how fast it's progressed since I jumped off the cliff of being an entrepreneur in publishing. So it's been exciting. Just had that 1 year anniversary last week.
Well, that's kind of an inspiration, kind of almost where you can start our conversation. Again, being live is exciting because I think the interaction with so many listeners out there who are thinking about taking that jump, thinking about making a career move, thinking about, am I scared? Yeah. Is it going to be a little bit, unsettling waters? Yeah. But the opportunity to go outside your comfort zone, to make that extra step to advance your career, your life, because if you're not happy, you're not as productive as you can be. And I think what you've done and what I've done is we found a way, and again, it wasn't easy. If anybody says this is an easy transition, they haven't done it like you and I have. But the fulfilling emotion and passion of what we do feeds in our work every day. And that is the entrepreneurial spirit that I sense from you from the first day that I met you.
Absolutely. It has to be fueled by passion, and you really can't give up. I'm reading, not finished yet, but I'm reading the book Think and Grow Rich by Napoleon Hill, and the influence that he had on so many multi-billionaires, and when he interviewed many of them, it was all about persistence and driving what might have been perceived as some crazy idea, and how it took so much time. I mean, just podcasting, for example, in 2009 and starting, if someone would have said, hey, you're going to make a living at podcasting, I would have laughed and been like, no, I'm going to keep my day job and stay safe. And it took quite some time to, like I said, jump off the cliff, to be able to trust in yourself and in your network and what you've done all along. And that kind of brings me to the first topic of today's opening, RX Fusion. And that is something that you and I hold dear to our hearts, and that is the role of the pharmacist and untraditional career paths for pharmacists, which are not as untraditional as we thought maybe 2 to 5 years ago. And one of those roles is working directly with a primary care physician in community. So there's lots of listeners out there that might not know what this is about, but Ken, you're kind of the godfather of this concept, definitely to our Pharmacy Podcast Network and to me. But give our listening pharmacists and even some of the physicians that might be listening an overview of what is the concierge pharmacist.
Well, as the godfather, as it were, I'll say, drop the gun and take the cannolis, because what the concierge pharmacist is what every listener is on this nation of pharmacists who want to advance their career. We all want more. Putting a name on what we do. We are healthcare providers, and we can go down paths to say why we don't get recognized. But what we do is work for the patient. So I made a decision that patients came to me when I worked in retail pharmacy, and I served them and in environments that were challenging, but I served them to the best of my ability. But those patients came to us at the tail end of the health, sequence of going to the doctor, of having that prescription prescribed, of seeing a specialist, of getting lab tests. And we were just the last vestige of that patient's pathway. And, when you go on a journey, those last couple of days, those last miles, you're not happy. You're kind of burnt out. And I didn't think that any of those patients, until I got to know them, came in because they were happy to see me. They were sick. They were angry. They were rushed. They were in pain. They wanted to get in and out quickly, and they didn't really want to have anybody get in their way, like insurance companies, like prior authorizations. And we were the last hurrah for them, and we took a lot of the crap, a lot of the things that maybe that doctor wrote the wrong prescription and didn't realize that there was some interaction. So we were the fail-safe. So I found that enjoying retail, which I do, and if I wasn't disabled, I'd be right with Joe Violano at the Seaford store, saving lives in Seaford, New York, because I love retail pharmacy. I don't love the big box influence of them on the metrics because they've lost sight of the patient. So knowing that, and knowing I wasn't going to change the big box retailer, and I did want to be on the corner of happy and healthy. So what I did was I crossed the street and I went to the doctor because I knew that's where the patients were. Todd, I knew, you kind of have to search out the people who you want to help. Either they come to you, which is a reactive scenario, and then you got to juggle. Oh my God, what do they need? What do they need? How quickly? Whatever. Or you go to them. And I went to the point of care. And if you ask me what the 3 words are about a concierge pharmacist, they're care, compassion, and empathy, but doing it at the point of care. So you must collaborate with the individual who owns that relationship, and that's the physician.
That's a really good point. The Board of Pharmacy Specialties offers board certifications in 11 different specialties in pharmacy practice. So you could think of these 11 specialties always being attached 100% of the time to a physician, where you can build that relationship and that expertise, and the expertise that a physician looks for because they have a patient base in that sector of geriatric care, and how the consultant pharmacist is so important for that time of our lives. And pharmacotherapy and psychiatric pharmacy, psychotropics, and how dangerous it is to level someone that's dealing with depression or dealing with schizophrenia or something, and how a pharmacist is so valuable to a physician in guiding them for the disease state or for the sickness or the chronic condition that they're experiencing. So Concierge Pharmacist is in its infancy and its beginning, even though you started it 5 years ago, and you've been at this over and over again of how many meetings you've had with your own physician and talking to them and about that. And now your team has expanded and you're starting to grow through schools of pharmacy to teach the P3, the P4, and the resident like pharmacists to consider a world where you're serving the patient directly in partnership with the physician. And that's exciting.
Well, actually, you touch on something, and I have to do a call out for Dr. Greg Alston, who you know, as the founder of RxVIP, the only thing I really did was I found Dr. Jason Cavallina. I found Dr. Crystal Cruz. I found Dr. Greg Alston, and I found the other passionate individuals who want to be providers and enhance their role. And we just got together and said, no one can say we can't do this. And even though we got so many things put in our way because the business of pharmacy is not ready for this enhanced patient engagement. So what we did was we said, let's not fight the tradition. Let's not fight the veterans. Let's go to the next generation and let's see what they want. So educating, empowering, inspiring, and then hiring PharmDs coming into our profession now during a pandemic, where they're the most resilient healthcare professionals ever, is the best way to provide a status. Because when you ask a PharmD, a P3 or a P4, what they want, they say, well, I want something clinical. Now, I think maybe, Todd, and you can probably speak to this better than I do because you've been doing it longer in the business of pharmacy. Do we make a mistake by calling ourselves different kinds of pharmacists? Do we make a mistake by saying, well, I'm a hospital pharmacist, or I'm a consulting pharmacist, or I'm a specialty pharmacist, or I'm this kind of pharmacist? Aren't we all pharmacists? All right, and if we're pharmacists, don't we want to be the best pharmacist we can be? And that pharmacist model, and you're showing our website, and I appreciate that, but we've even expanded because we believe a PharmD today is as competent, as certified, as educated as any medical practitioner in the healthcare continuum. So PharmD Concierge is the place that we want our listeners to land, because PharmDconcierge.com is the new RxVIP. It's the new pandemic. We had to pivot, Todd, because the healthcare industry got flattened and is still flattened in terms of rebuilding. So the academy that Greg Alston is built with Dr. Cruz and their direction and their vision. We made presentations to University of Tennessee, LIU, others, Tennessee, that they are looking at this as really core deliverables and curriculum for the next generation. We're thrilled to serve it up to them.
We're going to talk a little bit more about that when we come back. But first, I want to share a message from a sponsor who has been critical to the growth of the Pharmacy Podcast Network and the very first podcast ever that is CE infused. You get your continuing education after listening to a 20-minute, 30-minute program, and that is CE Impact. We'll be right back. Hey, Pharmacy Podcast Nation, you got to listen in every Tuesday to stay up to date on the most recent medication therapy topics. Game Changers creates awareness about pharmacotherapy and clinical practice changes that can significantly impact pharmacy practice. Every Tuesday, a new episode of Game Changers is published on the Pharmacy Podcast Network. Thanks so much for listening. And always remember, the pharmacist is the hub of healthcare. We are back. RX Fusion, if you're just joining us, this is the very first live RX Fusion internet radio for the pharmacy industry, something that I am so excited about all the time. Being able to be full-time podcaster and curator of the best innovations in pharmacy and the ideas coming from pharmacists is so exciting. Ken Sternfeld is with me, founder of the Concierge Pharmacist. We're talking about untraditional, non-traditional roles in pharmacy and how that's going to impact the practicing pharmacist. And we were just talking about clinical pharmacist and being able to say, what does that mean to you? When I say clinical pharmacist, how does that differentiate from a community pharmacist or a long-term care pharmacist or a specialty pharmacist? In my opinion, Ken, I think all pharmacists are quote unquote clinical.
I agree. And that was my point before the break. And by the way, a call out for CE Impact. The fact that you can do CE credits by listening to valuable information at your own leisure. It's incredible. Yeah, you can sign on for a CE course and then turn it off and get the credit, but to listen to it. There's something about how did audiobooks do so well? You want people to talk to you. You want to listen to them. And you want to not feel that you want to feel engaged. And I love what CE Impact is doing. And I think they are a game changer in the way that education and certification CE credits can be delivered. I think that partnership with the Pharmacy Podcast Network is extraordinary. But back to the question about, I'm sorry, you were going to say something?
No, I was just going to say, I agree with you, Jennifer and Suzanne with CE Impact have just been amazing, and they're very involved. They're very vested in education and evolving how we're consuming education. So it was a natural fit that they became integrated into the Pharmacy Podcast.
Well, the point you made about clinical really also ties into education and continuing education. I know that education never stops, no matter what age you are. So I think the clinical comment that you made, we are all looking for the clinical. We have the expertise. We've gone to school for it. So I think the difference between clinical and traditional retail is you don't get a chance to use your clinical knowledge. But I think every pharmacist, whether you're a consultant pharmacist, long-term care, you must embrace the clinical aspects of patient care, of medication management, and of disease state management, because that's why we went to school. We went to school to be clinicians, to be doctors of pharmacy. In my case, registered pharmacist. But at the end of the day, what we want to do is help the patients. So I think the clinical application or definition is what a pharmacist is. They are the clinical expert relative to medication and disease state management. We learn that in school as well.
So let's go back to the PharmD resident. Let's go back to the resident program you talked about and kind of expand upon what does the new standard in patient engagement mean if I am a PharmD concierge pharmacist?
Well, the first thing we want to do is say that it is not a traditional residency program. It's not a PG1, it's not a PG2. What we really have created a PGU. Our resident initiative means the pharmacist resides in the physician practice. And this was developed, Todd, before the pandemic. So we don't use the resident program terminology because it is confusing to some who are so focused that, oh my God, I have to have a residency to work in a hospital. That's the business and the academia of our profession telling you that. And we support that. We're not the bulls in China shops. We agree with that. But the PharmD Concierge program is what the resident program evolved to, because the concierge approach to patient engagement is working directly with the patient under the supervision of a physician. We want the pharmacist to practice at the height of their professional skill set. And the only way to do that, Todd, until we all get provider status, is to work in collaboration. So if you ask me what the PharmD Concierge program, which was the old PharmD resident program, is, it is a true collaborative, interprofessional scenario where pharmacists can practice at the height of their skill set, of their diploma, and be paid for the professional services they deliver. And that list that you're sharing is a small sampling of what can be done now because of COVID-19. You don't see COVID-19 at home testing on that model. And I'll share in the chat section, if you like, a website that has been developed since COVID-19, because it's really important that people pivot. If you go backwards during a pandemic, it's gonna kill you, literally, maybe, and figuratively. So what we've done is we've delivered the PharmD as that concierge entity. So it's pharmdconcierge.com, Todd, if you'd be kind enough to share, where it shows COVID at home testing. It shows diabetic remote patient monitoring. Diabetic patients are challenged. It's a horrific disease. So the ability to reach out to them and have 24/7 real-time blood glucose monitoring. Today I spoke to the diabetic educator at LIU, and I said, this is where you need to educate and empower your future next generation. So the site looks a little like RxVIP Concierge, but it's the next generation, Todd. And I appreciate that you're sharing it.
Absolutely. This is important. This is something I believe in, Ken. I believe in how pharmacy is changing and the pharmacist role is changing, and the ability to get pharmacists more involved in therapies ongoing with diabetes, with mental health, with COVID-19 and the pandemic and infection testing, as well as the coming vaccine and what that means. If you're giving a vaccine for the coming COVID-19 shot or whatever, probably obviously shot, but if you're doing that, there's other things happening to that patient. There's children that might be part of that family. There's stresses that the community is experiencing. So having that touch point with your patient and what this means for an opportunity for pharmacy is immense. It's huge. And I think your entire model of being a PharmD, a concierge PharmD, Ken, I think it makes absolute sense. Plus, I think it's going to save us money in the long run.
And it's going to save healthcare money, because risk assessment, when my first partner and my best friend in business now, Peter Becknell, we partnered up initially to take the RxVIP model and make it scalable. So it could be in ACOs and clinics and healthcare. We started in concierge pharmacy practices. But what Peter did was he escalated our vision and made it scalable so pharmacists could work across the country in physician offices and clinics and hospitals and deliver value-based services through the collaboration that was created. Peter and I are always looking at the next level. We're always pivoting. And I asked him a question today, and actually I'll ask you the same question, because sometimes I don't have any of the answers. I'm always looking for the answer.
Yep.
And to me, the question was, can we serve the patient directly? If there are so many barriers that are put in our way for insurances and this and the healthcare system traditionally, does a pharmacist and a patient have that union? Can we connect to the patient? If we were to talk, Todd, today about how a pharmacist could do a wellness prescription checkup, with a patient on the phone to check their screenings for COVID, to check for a pharmacogenomic analysis, to help them find ways to save money on their prescription. Would they come to us? Yeah, I think they would. Would they trust us? Yes, I know they would. Would they feel that even instead of paying a copay and not getting the kind of service that you're getting or you need in healthcare, can that pharmacist elevate his or her position as a true healthcare provider? And I said to Peter, I'd like to do that. I'd like to go directly to the consumer. And I have friends like Todd Urey, who I know can reach those people, and people like Newswire, and people like our partners who have always thought that the concierge vision is a good vision? Can we help more patients by going them directly? Todd, do you think that there is a consumer connection between a pharmacist and a patient?
Yes, it's meeting patients where they are. It's coming to them. And when I think of what healthcare professional, what healthcare provider is the access, it's that community pharmacist, and it's meeting patients where they live. It's meeting patients where they are, and I believe in that. I believe in that wholeheartedly.
Good. It's interesting. We do say that we put our stake in the ground. We are the most accessible healthcare provider, more than physicians, more than specialists, more than anybody. I'm concerned, though, that if we put that stake in the ground and only live with that, we know patients aren't coming back to the pharmacy as often. So I mentioned to Peter that I believe outreach, going directly to that consumer, being proactive instead of reactive, is a way that we can save more lives. Because I'll tell you, it's happening in healthcare. I was scheduled for bariatric surgery. I'm obese. And it was supposed to be in July. And of course, you had to go through a whole process months before. Got all screwed up for COVID. I was losing weight, and then I'm gaining weight. I'm grazing, around the refrigerator because of COVID. So, I put the surgery on hold. I'm getting calls now from surgeons at the bariatric, like they're trying to sell me a used car. Like, hey, come back in, come on in, whatever. Now, I kind of laugh at that, but healthcare has to come back, and a pharmacist call. Hi, Todd, I'm calling from ABC Pharmacy, or Dr. Good, Dr. Bad, whatever. I just want to see how you're doing during the COVID-19. I'm doing an outreach on behalf of the doctor. How are you doing? Are you managing? I know I'm struggling. How are you doing? I want to let you know we're doing an at-home COVID testing, or I want to let you know we can help you with your medication costs. I want to let you know we're here. They know we're there, Todd. They know that we're on the corner of every community.
Right.
But they're afraid to go outside. We have to go to them. We have to connect direct to the consumer, in my opinion.
So we want to open this up to our Twitter chat. We just started with hashtag RxFusion, and we had participation from Dr. Justin Kirby. He's at JAK or JA Kirby 89, and we appreciate your feedback. The question was, what does a clinical pharmacist do, which a community pharmacist doesn't? What's a clinical pharmacist mean to you? And to participate in this conversation, just put in hashtag RxFusion to become part of the conversation on Twitter. Justin, thank you so much for your answer. And Ken, I want your feedback on this. Justin said community pharmacists are clinical pharmacists. And
I agree 100%.
Let me give some applause for that answer, because that's absolutely 100% correct. Community pharmacists are clinical pharmacists. Thank you, Justin.
100% correct, Dr. Justin, because in that environment, despite the challenges, despite the workload that you're put on, you do focus on the patient. Even in a CVS environment where I work, which is a challenge, I won't use a different word, I was able to focus on the patient and be a clinical pharmacist. So Dr. Justin, 100%, every pharmacist can use his or her clinical skills. You just have to take the time and make the time. And you can say, oh, I don't have enough time. It's the queue, it's the this, it's the that. Okay, no one wants to hear that, especially the patient. The patient wants to be served. So if you focus on the patient, you'll always be practicing as a clinical pharmacist at the height of your profession.
Absolutely. And thank you for saying that, Ken. I believe that the division between one pharmacy sector and in the next, it's starting to close up. We're not being snobby about being a health system pharmacist versus a specialty versus a long-term care versus a community. You're a pharmacist, for goodness sakes. You have a role to play. And it's not to say that you don't have a specialty. I understand specialties and I respect specialties. There are oncology pharmacists. I just talked with Dr. Coons this afternoon, and she's going to help me develop some oncology specific content for pediatric pharmacy. So I'm excited about that. There are specialties, but you're all clinical pharmacists. So I'm very appreciative of that. We're going to take a quick break, which is going to be brought to you by RxSafe. RxSafe is an automation technology provider. They specialize in adherence packaging and have helped pharmacists and pharmacy owners to not only save money, but save lives through adherence packaging. RxSafe is a PDS strategic partner. Their website is RxSafe.com. Bill Holmes and I are friends. I absolutely love this team. Very committed to the growth of community pharmacy. They're moving into long-term care pharmacy. They have been there for some time. They're also going to be getting into specialty. They also have adherence programs dedicated to vitamin therapies that will complement specific disease states. So take a look at RxSafe. Once again, it's RxSafe.com. And we're about to go to the news. Ken, holy smokies, one of the largest settlements, and probably it isn't settled yet, but Purdue Pharma pleads guilty to criminal charges for opioid sales. The Justice Department announced an $8 billion settlement with the company, and the members of the family, the Slacker family, will pay $225 million in civil penalties, but they're also going after criminal investigations as well. That is huge, Ken. I was blown away by that, which I think came out about 2 days ago.
It's not enough, Todd. And I have 11 friends on Facebook, and I posted that exact article 2 days ago. Everyone has been impacted by the opioid epidemic. It's not a pandemic, but it almost is. And we can't forget that so many people have died as a result of actions of manufacturers who knew. You know, you don't put so many drugs into the market without the knowledge about what those drugs are doing. I don't think $8 billion is enough, because of the lives that have impacted, not just the people who have died, but it's a brother, it's a sister, it's a mother, it's a father. It's horrible. And I believe people need to be held accountable. And I hope this isn't one of these things like where you saw on Erin Brockovich, where, the company, I believe they've already filed. I don't know. I don't want to misstate. Where they filed Chapter 11 and whatever. And they have so much personal wealth, $225 million to them is like $225 to you and I. So I don't believe that you can price up the pain and suffering and damage that they have done to humanity by just saying it's $8 billion is enough. There is no quote unquote settlement to human life loss, in my opinion, for what it's worth.
I appreciate you saying that. I want to give a shout out to Dan Schneider. He's known as the Netflix superstar in the documentary, 4-part documentary called The Pharmacist. And what an amazing opportunity it was to interview Dan about the Tunnel of Hope. It's an organization that Dan has passionate about. He lost his son to the opioid epidemic, and he has done some amazing work, along with Camille Schreier, who is our current Miss America, who's a pharmacy student. They've partnered up on several initiatives publicly and have gotten a lot of press around the opioid epidemic, and more importantly, embracing the OUD sufferer and surrounding them and trying to get rid of that stigma that just because you're addicted to an opioid or addicted to drugs, that you're a lost cause. That's absolutely not the case. And those two people are beautiful. I just want to give a shout out to Dan, give a shout out to Camille. We're going to continue to support you both. We'd love to have you guys back on the Pharmacy Podcast. We had Dan once, then we had an interview with Dan and Camille at the same time, which was a treat for us. But take a look at the episode. I will have this in the show notes when the podcast publishes. We are running live right now on YouTube. We're streaming live on YouTube. So if you wanted to follow along and look at Dan's efforts, it's tunnelofhope.org. Once again, that's tunnelofhope.org. Ken, did you get a chance to watch the Netflix special, The Pharmacist?
I did in part. I've been watching Moana and Frozen a little bit more because of my grandchildren. So my time management recently, thankfully, has been a little bit shifted. However, I always have room for a Miss America. So I think that she would be inspirational as a woman who has advanced her career and is at the top of her profession. I'd like to have her speak to our students. As you know, women of pharmacy dominate, thankfully, our profession, 65%, I believe. And we, with our academy, are really mentoring the next generation of women of pharmacy. And we have over 220 API students in our rotations at the academy. And Dr. Greg Alston, I think, would love to have both Dan and Camille on to inspire next generation PharmDs about how they should focus on the opioid epidemic. Because the worst thing, another worst thing that could come out of the pandemic, Todd, is if people lose focus on opioids and the fact that before the pandemic and still now, it's a horrific, horrific epidemic that still needs tremendous amount of work and support.
Absolutely. I wanted to just make points on some topics that I want to get your opinion on before we get to our first guest today, Ken. And once again, coming back to the news, CVS wants to immediately hire 15,000 employees to prepare for an expected rise in COVID-19 and flu cases this fall and winter. More than 10,000 of those will be full-time and part-time licensed pharmacy technicians who can help dispense medications and administer COVID-19 tests. The expanded staff could also help CVS prepare for the rollout of the COVID-19 vaccine if federal officials allow pharmacy technicians to administer it. There's some good and there's some bad around this story, Ken, with regards to it being cough, cough, CVS in and of itself. The pharmacists that work for CVS are my most favorite providers and most favorite people in healthcare. I love you. I adore you guys. But the monster that is CVS has really caused a punch in the face to many pharmacists who really wanted to grow their career out. And it's just the fact that sometimes I feel that they're more placing vision and focus on the profit of their organization, especially with their coupling and their PBM shenanigans. And rather than getting into that, which is another show, I did want to ask you a question about the hiring of 10,000 full-time employees. In most cases, it's going to be the pharmacy technician. And the balance between what we just got done talking about, the world of clinical versus the world of kind of block and tackle from a pharmacy technician. But what do you think of this story, Ken?
The clinical opportunity to work in a CVS environment is non-existent. And it doesn't mean that they're bad. They are from a PBM perspective, but they're trying to serve the community. And I don't speak bad about their the good things that they do. I just raise awareness to the fact that if you're going to be hired by that company, you better read your employee manual. You might even want to have a lawyer on retainer, because when they're done with you, they're going to get rid of you. And by hiring individuals, I'm now talking to 3 CVS individuals who are going to be interviewing in the next week or 10 days with their supervisors to be hired coming out of school. And I know what they're looking for, CVS. If you read a supervising pharmacist job posting about what they're looking for, and you really read it, there's nothing in there that enhances your role as a pharmacist. If you want to go to business school, go to business school. If you want to go to pharmacy school like I did, I don't want to do that. I want to be a clinician. There is no clinical opportunities at CVS. And I can tell you one thing again. I was in the Emerging Leader Program, and it was all about business management. I knew more business management than the people they were teaching me, but that didn't matter. I wanted to learn more. In that entire time that I was in that Emerging Leader Program, not once, or as a pharmacist while I was there for 10 years, did they do anything to help me be a better pharmacist. They wanted me to be a better business person, a metric guy. But I believe that the hiring will lead to more firings, because you are a fixed expense at CVS. And when their numbers go down, people's heads roll. And they don't want to fire you because that's too expensive. They want you to quit. And that means more pain for a pharmacist at the retail environments of CVS. And that bothers me. But before I get off this thought, there was one other CVS Walgreens announcement that bothered me also this week. The fact that they have contracted with the government to do the COVID testing in long-term care facilities. And I think that's another stagger at the heart of consulting pharmacists who have been serving long-term care. And only because they're big and brawny and can throw their weight around, they are going to destroy the long-term care community pharmacist, that consultant pharmacist who's been serving that market, because they're going to get shut out of the COVID vaccine, and CVS and Walgreens, because of their behemoth PBM monstrous scenario on the White House lawn, because they made drive-through windows for COVID, they're going to kill more pharmacists and kill more pharmacies than anyone on the planet. And that bothers me.
It bothers me too, Ken. And when I realize it's more about the profit of the engine that they've created, and less about the patient, and less about the pharmacist, and less about the evolution of the pharmacist role. And it's just a log jam of let's increase our stock price. That's very, very frustrating. And there's some good of this. I'm a glass half full guy. I've always been positive, and I absolutely agree and believe that CVS's days are numbered. And as the model that they are today, I think they're either going to have to evolve, or someday we'll be talking about them differently, because you can no longer be reactionary and superficial in healthcare. I think value-based care is going to help to transform the role of the pharmacist. And I think the best pharmacists, and I'll say this again, I think the best and the most passionate pharmacists are going to become concierge-like pharmacists, and working with patients directly, collaborative care with physicians, diving into specialty disease states and being sought after as specialists. Like my friend, it's known as the pain doctor, and you can go to paindr.com. Jeffrey Fuden, he is an amazing pharmacist. He is sought after as a pain specialist, and he's a pharmacist and has been on the podcast a couple times. But it's people like that, it's pharmacists like that are going to sprout out of the 380,000 active pharmacists in the country. And I think that CVS, unless they change their ways and be more inclusive to the clinical side of pharmacy, and we be more about healthcare and less about profit, I think we're going to see massive changes in the national chains.
Todd, it's a culture. From the first day I walked into that store in Bayshore, New York, it was a culture that you can't change. The culture is at the top. They are not going to change, and they're not going to change. And no matter what happens, they're going to continue to do what they do. For me, that's a good thing as a concierge pharmacist, because I don't need an HR department. I don't need to run ads. If I did one call out, which I could do today, call out to all CVS pharmacists, the 50,000 people who aren't going to get hired, who now will probably get pushed out or fired, because the people they're going to hire are younger, less expensive, maybe don't have the opinion. They need that job. They need it. CVS is going through a cutting by hiring. And I know this because some of the management at that company, I had individuals who knew them, and you have to cut the bottom 10%. That's their bottom. You have to cut the 10% of your lower performing people. And you're not going to fire them, because that would be horrific. Their lawyers would be tied up forever. They want you to quit. And they want you to quit by making your life miserable. And that's what they're going to do. They're not going to change. And we should do something, Todd. I've never in 6 years ever asked a CVS pharmacist or anyone to leave their job. Ever. Not when I was there, and not even today. And everybody wants to leave CVS, who I talk to. Everybody wants to get out. I say to them, do what I did. Take a day off. You're off. You don't work 7 days. Take one day and do what we do. So I'll tell you right now today on Pharmacy Friday, on a live show, if any CVS pharmacist or any CVS technician, intern, wants to take one day off a week and do something that's clinical, that will reward them and that will compensate them, let them get in touch with the farm through this show, and let's make a difference at the bottom line for CVS by not letting them have the people who they really need.
I want to continue with news. Something came up that I was very proud of. Nimesh Javeri has now been promoted to the Health Mart president position as community pharmacy, alongside being a McKesson senior vice president, and also Ayad Farah, who's been named president of Health Mart. I want to give a congratulations to these gentlemen. I've known these guys have been part of my LinkedIn network for more than 5 years. And Nimesh has been on several podcasts along with Avatum Health. Avatum Health is the manufacturers of TheraWorks Relief, a topical pain relief, and they've done some contracting with the Health Mart team. But I like when I see people, good people that believe in pharmacy and pharmacists. I like seeing their success, and I just want to give a shout out to both Nimesh and Iyad.
I want to do the same, but it's a personal thing. I don't know the gentleman, but through your conversations we had. But my dad was an independent pharmacy owner 60 years ago and had a store in Jamaica, Queens. And I know that if he was alive today, he would want to be under the Health Mart umbrella, because what they do for community pharmacists, for independent pharmacists, is so important. So I would love to have the opportunity to really do what we do, which is bring more clinical, there's that word, clinical services to Health Mart with no out-of-pocket expense, and their ability to really enhance their position in every community that they have their stores in. It'd be my pleasure to have that conversation.
I think today's buzzword is clinical pharmacists, because you're all clinical pharmacists. Let's give a round of applause to the clinical pharmacists during Clinical Pharmacist Month or Pharmacist Month. You're all clinical pharmacists. So I appreciate that, Ken. I want to also talk about, before we get out of the news section, is there a cure for COVID-19 on the horizon? Is there going to be a community pharmacy near you that's going to have the expertise and the vaccine and everything that comes with that? Is there a additional supplementary solutions, including vitamin D? And can it protect you against infection of COVID-19? Or is this just a bunch of hooty winkle talk? I just made up a word, hooty winkle. And what do you know about that? What do you know about vitamin D and sunshine and COVID-19?
It is hooty winkle. I think what has to happen, and you can't tell people to do it, they have to feel the need to wear a mask. They have to feel the need to social distance. They have to feel the need to wash their hands. They have to feel the need to work their life, not in a shutdown mode, but in a mode that is respectful of the fact that this virus is horrific and easy to spread. The treatments, when you see remdesivir being approved, are wonderful advancements. Things that we're doing a clinical study with a doctor in Lynbrook on a CBD infused mouthwash to lower the symptoms. There is going to be tremendous opportunity for new things for pharmacists to talk about how they can help the patient in the community. But I believe, and I work with a number of independent pharmacists here on Long Island and a number of stores, I believe it starts with being the leaders in getting the message out that you really need to do the basic things that are important to stop the spread of this horrific disease.
Absolutely. I agree with you. I also know that the insurmountable amount of bad information that's out there can be changed and can pivot just based on the community having access to a pharmacist to kind of clear the way of all the smoke and mirrors about, do I wear a mask? Do I not wear a mask? Where's the vaccine? When's it coming? Do I take essential oils and spread them all over my body to be immune? It's overwhelming, but it shows us that that pharmacist and the pharmacist's voice is really more important than ever.
Todd, when I worked at retail, I can remember thousands of times when I didn't have the answer. And the choice was to make it up or say, I don't know, but let me see if I can find that answer for you or that resource. Sometimes it doesn't make you look like you know everything, because who does? I've seen too many pharmacists or students of pharmacy go to a consultation window and try and tell that patient everything they know, everything they learn, but they haven't even listened to what that patient is even asking. And I believe finding the resource is as important as knowing it. One of the things we did is we decided early on in the pandemic that there was so much misinformation, and there's still now more. It's coming out. You can't possibly start. So I had to say to myself, as a patient, who do I trust? Do I trust the news? Do I trust the White House lawn? Do I trust the politicians? Do I even trust the doctors? I don't know. Now, for what it's worth, the CDC, for me, and this is just me, unless such proven otherwise, I think that when the CDC puts out some information, you have to kind of think it might be accurate. It may not. Nobody knows anymore. So I connected with a company that I could get daily information from the CDC. That was public health information, contacts, local tips, things in my local area, resources in case I needed, if I was positive or if I was negative, because we all need support. So if you just text, to a number 67634, and like the Pharmacy Podcast Nation, all 70,000 of your listeners every day as pharmacists can get information about the real information that I believe, as I watch it every day, is comforting, it's companion, it's reach out, it's connecting. Do I believe everything? No, you have to make your own assessment, but you need a trusted, and who better than a pharmacist to deliver, 67634. Just text it to any phone and then see, and you can always turn it off. I haven't turned it off since I started doing it in May, Todd, because it gives me enough information that I get a little bit more comfortable than I did before.
Say that again, Ken.
Text PNN, Pharmacy Podcast Network, PNN, to 67634 on your cell phone. And it'll come back through RxVIP. That's RxVIP, and you'll have an opportunity to opt in. And if you want it, opt in. If you don't, there's no cost, whatever. What do they say? Text messaging rates apply or some crap like that.
Yeah.
But the bottom line is, Todd, this is connecting directly to the CDC. And it's the support we all need. And if you are a pharmacist and you see this, then give it to every one of your patients. Say, hey, I'm doing something for you, Mary. I'm doing something for you, Bob, because we care about you. This is information that's valuable. And I hope you know that I'm giving to you as a pharmacist because I care. Use that. That's a good tool to have, in my opinion.
That's awesome. I really appreciate that. We really appreciate you. You're coming back next week, right?
Todd, it's Pharmacy Friday, and I'm going to come back
Friday.
every Friday until I get it right. And you know what? In healthcare, you don't really know. But I'm going to keep trying, and I appreciate you giving me the opportunity. I love the interaction. I have no Twitter. I have 11 friends on Facebook. You are my social media. But let's get the word out.
Absolutely.
Let's talk about a direct-to-consumer model. Let's talk about subscription models for pharmacists, for students, so they can get your content every day. Let's talk about giving opportunities to hire CVS pharmacists or Walgreens or any pharmacist. We're not singling them out. We have an opportunity for people to make a good opportunity to help patients and earn money. That's all.
Awesome. Next week, I have a surprise for you, Ken. I wasn't sure if you knew this, but next week is Pharmacy Friday on the 30th of October, the day before Halloween. And we are going to be focused on diabetes for the entire show. So we're going to talk about news about diabetes. We're going to talk about the Concierge pharmacist as a diabetes expert. And we are going to pull out much of the resources that you have so we can expand upon this, because we understand that there's more happening than just the diabetic issues that the patient faces. There's so much happening for the patient, their families, comorbidity and hypertension and other diseases that play into that. But how many people die per year, Ken, from diabetes?
Too many.
too many. That's it's true.
I'll
Exactly.
tell you one quick story. I used to be in the consumer electronics industry, and I was visiting a plant in England that was building loudspeakers. They're very automated. I walk in, and the manager and the COO is walking us around the factory, and there were people running around. It was like Grand Central Station. And I said, "How many people work here?" He says, "About half of them." So I kind of took that to heart. I'm sorry, that was my Pharmacy Friday. I'm sorry it didn't work. Anyway, too many people die. Actually, Todd, no one dies of diabetes. They die of the complications in not being able to deal with that horrific disease. So you really do bring up, on a serious note, the fact that managing a diabetic can save their life. There are certain diseases that you just can't cure, sadly. You can lead a healthy life. And if you would like, I would like to invite my DiaBuddy, Caitlin Grenier, who is my partner in the DiaBuddy Club initiative that we're going direct to diabetic consumers directly and through independent pharmacies, because those people have more diabetic patients in their databases than anybody, and we want to help them. If you would allow me, I would like, you've invited, no one knows more. She's an onset adult diabetic, and she's my partner. So I'd like to do that.
Absolutely. Okay. Let's invite her there. I do want to give shout outs to Bruce Nealon. He's known as the Road Trip Guy. He just released his third podcast, part of the network. I think it's a great interview to get to know him. He really focuses on community pharmacy. I also want to talk about our relationship with the APHA. The American Pharmacists Association has joined the Pharmacy Podcast Network, and we are taking their Locked On Pharmacy podcast to a whole nother level. If you want to participate in any of these conversations, please reach out to us, the Pharmacy Podcast Network, Ken or I, and you can send me an email at publisher@pharmacypodcast.com. And also, Ken, I want to make mention, if you haven't heard the Transforming a Nation podcast series, you have got to connect into these amazing pharmacists who are changing things like racism, who are tackling health disparities, and more recently, who are taking on the subject of sexual harassment. We've interviewed two different panels. One panel was a group of pharmacists setting the stage, and the next led by Dr. Rebecca Smith. She really helped to bring together other guests who were really focusing on how sexual harassment affected them in their careers as pharmacy students, but then also as residents. And we were talking with Ashley Barlow, her twin sister, Brooke Barlow, and Jackie Johnston, who is a PharmD and a surgical trauma neuro ICU PharmD, clinical assistant professor. I am so impressed with these women. These are strong pharmacy leaders and change agents, and we were so proud to feature them on the Pharmacy Podcast Network. But once again, if you haven't listened to the Transforming the Nation podcast series, please take a listen. It's certainly not clinical. It's more about what's happening in our world and how pharmacists are leading change, literally transforming a nation.
I did listen to it because we touched on it last week. And I think it was extraordinary because you say it's real life. We're pharmacists, but we're also living in a world that has sexual harassment and situations. And it's real life. I love it. And I'd love to have the opportunity to promote that with our students and have them on as guests at our academy as well, because that's a wonderful message to deliver.
Absolutely, I agree. It was exciting, Ken, to have you on the first RxFusion.live. It's been an honor, as it always is, to talk with you. If you are out there right now and you're listening and you want to be featured on this show, please reach out to us so we can get you plugged in. But Ken, thank you so much for being part of this.
My pleasure, Todd. Thank you again for giving me the opportunity to be with you.
You are listening to the Pharmacy Podcast Network. My name is Todd Urey. I am Pharmacist's #1 fan, and we thank you so much for listening to the Pharmacy Podcast.